Did you know that nearly 40% of patients who have severe asthma experience therapeutic inertia? I'm Dr. Kahn, a board-certified allergist. I see patients and treat patients who have asthma every single day. I think one of the most common questions that I get from my primary care colleagues, how do you know these patients are not responding? And what I'll say is you have to constantly check in with the patient. There are so many barriers that often come up, and we have to sort of figure out how to address all of those and adjust their therapy for their severe asthma. So yes, there are challenges in figuring out which biologic therapy to choose, but then the goal really should be to revisit that plan frequently, whether it's every few months, every 6 months with that patient. Are we keeping you out of the ER? Are we keeping you off of oral steroids? Are we keeping you out of the hospital? Anytime I start a patient on a therapy like this, I always tell them that those are the goals. Sometimes we do have to rely on our subspecialty colleagues to kind of fill in some of the gaps that we can't keep up with. But we also have to make sure that we're not falling into some of the misconceptions like, oh, the traditional inhaler should work. Why aren't the steroids working? We have to balance that with safety, side effects, what the patient can actually keep up with. And just because something didn't work previously doesn't mean that it won't work again. But tell me in the comments, how have you pushed yourself out of therapeutic inertia? Enroll today at reelCE.com.